Hello, my name is Dr. Stephen Katz, and I have been a dentist for 40 years. I have been coaching practices to be more successful for about 15 years. One of the things that I see in practices routinely is that patients who are coming for a first visit, a new patient visit, oftentimes will not show up. The question is, what causes a patient to not show up? And it usually is the fact that they don't have a relationship with the practice, that they may have identified the practice through a Google search, they've made contact by the phone, they've made an appointment, but somehow there may have been something in that phone call or something that crossed their mind that put up a little bit of a roadblock for them. And after getting off the phone, they have gone to look additionally for other practices on their search, and they don't have the courtesy to call back and cancel that appointment they made. One of the things that really differentiates a practice is to have there be initial contact between the doctor and the patient prior to that first visit. Where I first encountered this was with um, my mom and my mother-in-law both were treated by a breast surgeon when they had breast cancer. And I remember how comforting it was to them to speak to that doctor the night before their first appointment and have that doctor give them encouragement and give them optimism and letting them know how well he was going to take care of them. I adopted that into my own private practice, my dental practice, used it for many, many years with a great return in developing an initial relationship and developing some initial caring and trust. Have any of you been called by a doctor the night before your first visit? What would it say to you? It certainly says that that doctor cares. So the way that we have these phone calls done, and this can also be done by text messaging, is to have the doctor call the patient the night before the first visit and identify themselves. Hi, Mrs. Jones. This is Dr. Katz. I always like to call guests before they come to our office for the first time to welcome you to the office and to introduce myself. Also, to find out if there's anything in particular that concerns you before you come in so that we can be better prepared. If I get to speak to the patient, that's wonderful. If I don't, I'll leave the same message on their voicemail with one addition. I will say, if you have any questions about your first visit, please call my cell phone, and I would give my cell phone number. Now, a lot of doctors have concerns about whether people will take advantage of that privilege. In the 25 years that I have been doing this, I have found virtually no one take advantage of. The number of phone calls that I've received, you could probably count on one hand. But those who did call, it was for a good reason, and it was very helpful that I was able to make that contact. The advantage of having this phone call is it differentiates you from all other interactions that people have had with treating physicians and dentists. It really says you care. When you make that call, patients will say, "You're the doctor calling me?" And of course, I'll say, "Yes, of course I am. And I'm doing this because I care deeply about my patients." When patients come into the office, if you've left a message, one of the first things they'll say to the receptionist is, "Do you know that the doctor called me last night? That was so nice. I really appreciated that." And that goes a long way in creating a better relationship. What we find is relationships and the solidity of those relationships go a long way in promoting a higher treatment acceptance. There is a cycle of trust, and the more we do to create relationships, it shortens that cycle of trust, and it enables patients to make better decisions for themselves and accept more comprehensive care earlier in a relationship. As I said, these can also be done through text message, but I do believe that making contact between the doctor and a patient before their visit will make them a longer lasting patient with a much greater relationship, and will be more fulfilling for both sides of that relationship. Thank you for listening, and I hope you can use this to your benefit in your practice.